On this Friday on markets. And now, a new Access to Medicine Foundation report reveals that less than 10% of children with type 1 diabetes in 71 low and middle income countries accessed care in 2023. With global cases expected to reach 2.2 million by 2040, insulin remains out of reach for half who need it. Now, joining us to discuss solutions and also analyze the report's findings is the CEO, Jayasree. Jayasree, thank you so much for your time. So, despite coverage that we are seeing here in over half of LMSs, less than 10%, according to this report, children, with type 1 diabetes are reached by some of these initiatives that we are seeing around this diabetes conversation. So, let us kick off our conversation by understanding some of the biggest barriers when it comes to limiting the scale up of these vital programs.
Yeah, thanks again for having me on the show. So diabetes is a growing concern, and people living with diabetes need long-term access to insulin products and other products like monitoring devices. At the moment, there's projections saying by 2050, the number of people living with diabetes in Africa is going to increase by 142%, reaching nearly 61 million people. Today in Africa, 1.2 million children aged 0 to 19 years live with type 1 diabetes. And yearly, there is about 150,000 children that are diagnosed with type 1 diabetes, and probably many more, because diagnosis isn't available for many communities. And 50% of children will die within 12 months of diagnosis because insulin is not available, not affordable, or poorly distributed. You actually see that survival rates in high-income countries that actually have access to insulin and some of these particular products can increase drastically. So it's a matter of life or death. So some of these gaps can really be addressed by some of these particular programs as long as the insulin and insulin products are available for children.
And yes, Jayasree, you will agree that, aid of reliance is very important, or, donations for sustainability, which we are seeing. We recently saw the USAID being frozen. So in terms of risks which are abrupt, access loss, if support ends, let us look at some of the financial business models that maybe some of these pharmaceutical companies can adopt to ensure long-term affordability and also consistent, stable supply. And when we say consistent, stable supply, how feasible, how workable is that?
So all the companies that we analyze, and there are only three major companies that actually supply access to insulin and insulin products globally, right? So it's a very concentrated market itself, but all the companies donate at least one to one of these 11 initiatives that we actually found. So currently, all the programs that address children and young people's needs is going through donation programs. And donations rely on, as you said, goodwill of people, organizations, and governments, and it's not guaranteed. So the fact that current models are working really well is something that the report is actually highlighting, and it covers more, many countries that are in low and middle income countries. But what we need to do is go into more sustainable approaches. So commercial approaches need to be made more affordable. Governments need to step in to really look at proper partnerships that scale up access, especially in resource-limited setting, and reimburse care so people do not have to pay out of pocket for these treatments itself. So it takes many different stakeholders to address this particular issue, but it is solvable.
It is solvable. So let us also address the issue of weight loss here, because I'm looking at investments in weight loss drugs by insulin manufacturers, shaping these companies' access to medicine strategies in LMICs. How best can we approach this?
So on one hand, there's a lot of awareness of available products, globally for lifestyle diseases and like obesity and diabetes overall is still seen as a lifestyle disease. But type 1 diabetes is not a lifestyle disease. Children are born and affected by this, and it's not about their lifestyle itself. They have to manage care over the whole year. So there's a lot of misconceptions about what access is. But the problem at the moment we're seeing with weight loss drugs globally is there is a celebrity hype, high demand for weight loss drugs, and that's taking resources away from those that need it the most for diabetes care. where life and death actually makes a huge difference for them. So another example is there's also changes happening with some of the pharmaceutical companies phasing out insulin pens. So those are very easy devices to use to administer insulin to your body. And instead of, while vials and syringes are still available, having a pen actually makes a huge difference for people, children, young people, caregivers, for adherence, for usage, for managing stigma. And there are additional risks associated with syringes. So we need to really invest in care for diabetes products, because this is a 100-year-old drug. Insulin is a 100-year-old drug and needs to be made available for people all around the world.
Yes, and when you mention in, syringes, I'm looking at, offering newer insulin analogs and also devices, and also moving beyond the pilot projects, because what we are saying is a lot of people have new innovations, but we are not being able to move beyond the piloting phase. But let us look also at how this report aligns with the World Health Organization's Global Diabetes Compact. What broader systematic changes are needed to close some of these gaps?
So the World Health Organization's Global Compact calls on the pharmaceutical industry to address affordability, access, and sustainability, and governments to invest in access to chronic care so patients do not have to pay out of pocket, and really there's investments in health systems overall. But in this work, we actually uniquely cover the needs of children and young people who are often left out of existing programs that are out there, and covers insulin analogs, devices, products like glucose monitoring devices and strips. And the issue of how children, as they age, need to remain in such programs to ensure access, right? Because the programs may only be available for a certain age group or in a certain region. And, it depends on where you're geographically located and what age you are. You should have rights to access to treatment overall. So we're still hoping to see systemic changes in increasing investments from governments and local charities that really need to step up, and a broader range of children and young people's needs, so that across the continuum of care this can be done. And that at the same time, our message is very clear to the pharmaceutical industry: manage affordability, look at beyond these donations, scale up the existing programs so that we're reaching more patients all around the world.
And yes, you do mention government. Let us talk a little bit on some of the policies there, because I understand with the USAID being frozen, there is a lot that is coming into play here. Maybe you can just touch a little bit on what we have been saying of late, and also let us look at the public-private, investments coming into play here.
Yes, so governments, especially ministries of health and other local actors, can play an important role, and more so the onus is on governments to really step up, since international aid is reducing and donations are risky, right? And so I think some of the actions that we're looking forward to sort of enable is consistent availability of affordable monitor diabetes management, improving health education and awareness. And you can take inspiration from several countries. So, for example, in Rwanda, they have integrated diabetes screening, diagnosis, management is into the primary healthcare system. In Rwanda, they've introduced home-based assessments where someone brings diabetes support directly to people's homes, offering blood glucose testing, blood pressure monitoring, and adherence support. And the most important aspect is universal health insurance schemes. In Rwanda, most people are covered by the community-based health insurance system, which 90% of people are covered by the insurance. And they might pay 10 to 15% of the cost of insulin out of pocket. It's not perfect, but at the end of it, some of these particular insulin at least is made available. But diabetes meters and test strips are not covered by insurance and still can be quite expensive. So expanding sort of that coverage will really enable better usage and adherence, and in that way, ensure that the pharmaceutical industry is actually bringing all these products to the market in an affordable and sustainable way to address the needs there.
Indeed, Jayasree, we look forward to more developments on that. Well, that conversation takes Power Lunch East Africa on a break. We'll be right back with more, including economics of lending to the informal sector.